Report says over 2 million people, including women and children, are living with HIV in Nigeria. And despite the progress we've made so far in treatment, the issue of mother-to-child, prevention of mother-to-child transmission of HIV is still a challenge, which is why the National Agency for the Control of AIDS, NACA, reported in 2023 that nearly 26,000 children were born with HIV. Now, that was because many mothers could not access the services that would have prevented their babies from being born with HIV. As much as that statistic is disturbing, it is important that we have this conversation, which is why today we are gathered here. We're gathered because I have a crew to talk about the prevention of mother-to-child transmission of HIV. My name is Doris Mayushishe, and this is Gyna Plus, where we discuss health issues that affect women and girls in the society. And this program comes up every Wednesday at 6 p.m. You can always catch up with the repeat broadcast on Saturday at 8 p.m. And yes, we have an active YouTube channel, Afia Culture and Lifestyle. We have all the updated information where you can avail yourself, of the watch if you want to. And we have, I mentioned before that I have a full house. So after the break, you're going to meet my guests. These are experts who've been working with women and girls in the area of HIV. And also bearing in mind the fact that a few days ago was World AIDS Day. Maybe that's why you can see this on my t-shirt. So yeah, after the break, you'll meet my guests for this insightful conversation. Please stay tuned. Welcome back. If you just joined us, you're watching Gyna Plus right here on Afia Television. And today we are discussing something really important, and that is prevention of mother-to-child transmission of HIV. My name is Doris Mayushishe, and before the break, I did mention that I have a full house, and we are all going to be talking about this important conversation, being that, the month of December, it's always marked as the 8 months. First was the World AIDS Day, and today we are here again to talk about this. So joining me to talk on the prevention of mother-to-child transmission of HIV is Mrs. Ona Benedette. She is a Enugu State Coordinator, Association of Women Living with HIV and AIDS in Nigeria. It's good to have you, ma'am.
Thank you very much.
You look good with our the t-shirt, commemorating that yes, we are active in this movement. And also in the studio is Dr. Tobe Agujobi. He is a program coordinator mediating food-less privilege and women development. It's good to have you, sir.
Thank you very
much.
Welcome.
I can see the logo too.
Sure,
it's still a trademark.
Yeah.
Yes. The discussion is not something that you're very new to. And today is just one way of us creating more awareness as to why it's important for us to prevent the transmission of HIV from mother to child. So let's begin with you, Doc. When we say prevention of mother-to-child transmission of HIV and AIDS, what does it really mean?
Thank you very much for having me. When we say prevention of mother-to-child transmission, which is an acronym, the acronym is PMTCT. That's what we call it. What it means is giving birth to a child, irrespective of having a mother who is living with HIV and AIDS, and the mother will give birth safely to a child who will be tested negative to HIV and AIDS. So that's when we talk about it, having a put a control on the spread of HIV and AIDS. So, and this will bring about checkmate the spread of an innocent child who is just coming into the world, coming with an ailment he or she does not know anything about. So it's safe delivery. That's
safe
what
delivery.
That's exactly what we're looking.
Now, later on, I'm going to ask how much of a problem that has been in Enugu State.
Sure.
Madam Benedette, let's talk about mode of transmission. When I first, came across this term, what was running through my mind is at what point is it transmitted? Is it during breastfeeding? Is it while the baby is still in the womb? Or is it during delivery itself? So please talk to us about that mode of transmission.
Okay, thank you very much. Actually, in PMTCT, if a positive mother becomes pregnant, there are different modes of transmission. Means that the child can get the HIV. Number one is the child can get it in the womb if actually the mother's viral load is very high. If the mother's viral load is very high, especially when the woman got infected newly before taking in, the viral load will rise, it will skyrocket and rise to very high level. If the mother takes in that period, it's likely that the child will get infected. But if the mother did not get the virus immediately or sooner before getting pregnant, the virus at the initial stage of infection, the virus used to go very high before it started dropping gradually. Then if the child did not get the virus in the womb, the child can get the virus during breastfeeding or during delivery if there is no precaution. But what we are discussing today is preventing the infection, preventing the newborn from being infected. But if you go through the process of PMTCT, the child will not get it, even during in the womb, during delivery, and during breastfeeding.
Yeah, thank
Sorry,
you.
follow up to what you
Yes.
said. There could be a scenario whereby the mother could be negative, whereas the man who impregnated the mother is positive.
Oh,
Yes, such scenario could occur. And there will be a childbirth whereby the baby will be HIV negative.
okay.
Yes. So that's exactly what my colleague was talking about, viral load. The same applies not just to the mother, but also to the father as well.
Oh.
If the father keeps the viral load
Low.
low before impregnating the wife or the partner, the possibility of having a child who is positive will be next to zero. In that case, the mother would needless bother about all those protocols.
So in this case now, it means that the mother has to be negative for
Yes,
that.
the mother, if the mother is negative and the father ab initio was tested positive, but keeps the viral load low, that transmission to the child will not occur. But yes, it's just this thing.
Yes,
There's no
yes.
rocket science in it.
It is.
It's just like somebody who's hypertensive, who is and is placed on best practices, best medical health practices by the medical advisor or medical doctor, and you are following those habits religiously, taking your pills and this thing, your blood pressure will be low. When you go to any hospital or go to any administration, that blood pressure will be low. The possibility of having stroke or as it were will not occur. So it's just the same thing.
Just to keep to the
Yes,
take
just
your
keep your distance.
medications.
Yes, exactly.
Okay, now let's
Thank
talk
you.
about, so before the baby is even born, before the baby gets to a stage of delivery or breastfeeding, let's talk about the steps that should be taken, to ensure that there's no transmission at all. So let's say, for instance, a woman gets pregnant today and avail herself of all the antenatal, care and all of that. What are like the step by that's for a mother who is positive now. Are there step-by-step procedures that should be taken to ensure that it doesn't even get to a point where baby should be exposed to the virus?
Okay, the baby in the womb already have the immune of the mother.
Okay.
Exactly. So, and if the mother is HIV positive and is not mindful of the health habits, the time you're supposed to take your antiretroviral drugs, there are times you should take it.
Okay, like every day the same time?
Well, it's according to the prescription and the advice.
Okay.
Do you understand it? So, because, and there is a specified time you ought to take it. Once it's that time, you go and take your drug. Do you understand
Okay.
it? So that's it.
So during my intro, I mean, I quoted the statistics 2023. It may seem like it was far. We are in the end of 2025 now. And then that's because that was the data available at the time of this research. And for that's prevention of mother to child coverage, it actually improved from 33% in 2023 to 52% in 2024. And if you ask me now, I will tell you that 52% is still not a good number compared to where we are. And I like to know, in the case of Enugu State, you have been the one working in the field, you work with these women, different people, different age bracket. What is the situation like in terms of access to these services in Enugu State? I'll go with you, Madam Benedict.
Okay, thank you. Actually, there has been improvements in
this was a national. This statistics was from a national
even in
level.
Enugu, because it is the entire state data that accumulated to form the national
Of course.
data. There is an improvement in the prevention of mother-to-child transmission in Enugu State, actually, because a lot of intervention is taking place in Enugu State. All the facilities are taking care of positive pregnant women. And to start with, any pregnant woman is supposed to go to antenatal care. If the woman goes to antenatal care, that is when tests will be conducted. And the HIV test is a compulsory test for all pregnant women. In that case, if the woman is positive, it will be detected. and the woman will be placed into care earlier so that the child will not get infected. If the woman adheres to her drug and follow the procedure of a PMTCT, she's going to come out with a negative child. But if she did not adhere, it might go the other way around. It is very, very advisable that if every woman goes to ANC and during the routine test, it will be detected earlier and be placed on treatment so that the child will come out negative from the mother. And again, I wish to say something about the other aspect of PMTCT because we are preventing the newborn from being infected with the HIV.
Okay.
So it starts with it has four anchors or four pillars, the PMTCT. The first one is the prevention of childbearing woman from getting infected with HIV. Because if the women are at the age of reproductive age is not infected, then we don't have anything like transmission of a mother to child. If every young woman who are still at the reproductive age are prevented from getting HIV, then HIV among children will be completely eliminated. Then the second one is the prevention of unintended pregnancies among women living with HIV.
Oh.
Because in that aspect, if that woman takes a life, for example, if the woman viral load is very high and that woman does not want to take in and eventually she took in at that high point of viral load, there's the possibility of the woman having a positive child.
Yeah.
But if it can be prevented earlier, if you don't want to take in, you go through family planning and the rest and of so many of them, and you can come out with a negative baby. You can become pregnant whenever you plan for it. Then the third one is the actual PMTCT. That is a prevention of mother to child transmission that we are carrying out now in so many facilities. Then the final one is a treatment, putting the mother on treatment and equally the child on treatment when the child is being born. Because if any child born by a positive mother will be placed on a drug and a nevirapine to prevent the child from getting infected. The work of the nevirapine is to clean all the traces of the virus in the blood of the new baby and to prevent attachment of the HIV cells to the body, to the baby blood cell.
Okay. All right. Thank you, Madam Benedict. So when you mentioned something, you said the prevention. The third one is the actual prevention that you're carrying out now at different facilities. Now, my next question would now be, what are these actual services that make up this? This whole yes. I like to know step
Number
by
one is the ANC.
Okay, which is antenatal. Okay, which you already mentioned.
Yes,
that.
then carry out the routine test.
Okay.
And if you identify to be positive and pregnant, the treatment will start immediately. As soon as the treatment starts, you make sure you adhere to your treatment. We have mentor mothers who follow pregnant women or follow them up to ensure that they adhere to their treatment and follow them up even to delivery. When the woman delivers, it is the responsibility of the mentor mother to make sure that the child is administered with a nevirapine. If it is a high-risk baby, then you administer the double dose, nevirapine and zidovudine, to ensure that the traces of virus is completely cleared from the blood.
Okay.
Then you continue to follow up until the child is 18 months. As you are following up, tests are being conducted on the baby until that 18 months. And most of the time, you find out that at that 18 months, if the child becomes free of HIV, he will remain free.
Oh, I think that's the thing I wanted to ask. What happens after 18 months? Okay, now let's before I come to you, I mean at this point I think we should take a break because the next question is something that we'll just take a pause and then talk about it. You're watching Ghana Plus on Afia TV, and we are still discussing the prevention of mother-to-child transmission of HIV, and quite an insightful conversation if you ask me. So at this point we'll take a short break, and once we are back, we'll look at the challenges, the barriers, and what has it been like in actuality, talking about how they have been working in the field. We'll be back after the break. Please stay tuned. Welcome back. If you just joined us, you're watching Ghana Plus on Africa Television, and we see discussing the topic around prevention of mother-to-child transmission of HIV. And in the studio is still Madam Ona Benedict, who is the Enugu State Coordinator, Association of Women Living with HIV and AIDS in Nigeria. And of course, also Dr. Tobe Agujobi, who is a program coordinator mediating for the less privileged and women development. We've talked about quite a lot. And before the break, I mentioned that once we are back, we'll look at the issues around barriers and gaps that, I mean, you'll be working in the field. Meet these women, you've seen different things. Some people will tell you that, oh, they're shy to already go and get these drugs. If a woman discovers that she's HIV positive and she's pregnant because she lives in a particular neighborhood, the issue of stigma might be a problem. But talk to us about the real-time barriers that you've seen and how much of a problem that has been.
I'm beginning to feel you're helping me in addressing the issue. Anyway, actually, stigma is one core barrier to that. Shortly before I talk about the barriers, I want to highlight to the public, let them get to know this, that a woman or a man is HIV positive, though cannot prevent that woman or man to get married to HIV negative person.
Wow.
This is what we call discordant partners. I have had such scenario where people who got married close to 2 decades now, 2006, and they have been living. The status quo remains the same as it were. They had 4 children, 4 of them are negative.
Yes, it occurs.
So the status quo is still the same. Status quo is still the same. So this is good for this is part of what this program should achieve. Let them get to know that, I've even had a scenario of a friend who confessed to me, I've been dating a girl for like 5 years. At a point, the girl told me she's HIV positive. She practically died there. And when he ran for tests in 4 different facilities, he was negative. So it works.
And that's because the people are
of course
taking
that's
them.
it.
The medication
So coming
is
to
just
coming to the barrier stigma remains the barrier. When this first HIV and AIDS was first discovered, the kind of media that was given to it was so devastating. It made it in Igbo, they called it Obirina Jocha, and we know what the Obirina Jocha, stuff so full names that was given to it.
Yes, for someone who doesn't understand.
Of course, Obirina, what it means is that you are going to die. You see grave. So that's what it means. So these are some of the stigma created, self-induced stigma to it. So, and that stigma says of things. Do you understand? If somebody is telling you and you are relating with someone, all of a sudden the person, you get to hear that the person is HIV positive, your attitude towards that person immediately changes. As if it's just like it, it works like a killer rocket. No, it doesn't work like that. So that still brings about the stigma. If when somebody is HIV, and because the stigma is basically because they have the mindset that, oh, this lady is HIV positive. No wonder she has been loose. She has been sleeping from one man to the other, this woman to the other. Everything about it, they have the mindset that is sex. That is being contracted through sex. If HIV and AIDS was taken away from sexual intercourse, people will take it more serious. That stigma will not remain. But because the media, first of all, destroyed it by the name and the awful names they gave it initially, and because of the associated causes, they say it's through sexual intercourse. Yes, it's been transmitted through sexual intercourse.
One of the ways.
Yes, one of the ways. But what about blood? We mingle with blood in various ways. You go to your dentist, you don't know how the best practices are being there. A good number of them practices it very well, but you see so many sharp objects. You have contact with blood. What about those media? What about various means of this thing? So, but because that's the sexual thing, you see that person to be loose. You see that person to be a harlot. So, and because that person don't want to be associated with that, he or she will not easily be going to access medication at the nearest place. You see somebody living in Nsukka coming to Enugu to access, for how long are you going to keep it? When you don't have the transportation money, you're going to face a huge challenge. You talk about the economic barrier. You have not even fed very well. You are talking about transportation, you're talking about so many things. Then the support agencies who are helping us bring this to ameliorate this procurement of drugs and test kits. So just like now currently, we that are in the street, in the communities that are addressing the prevalence of the AIDS transmission, we are running shortage of test kits.
How much of a problem is that?
So and you don't see it in the market.
So then
it's not like malaria test. Before you think the test kit is like malaria test, whereby you go to the pharmacy shop, you say, give me malaria test, or pregnancy test, the one that you urinate and do all these things. No,
and that's because there's no funding, because the funding stopped.
Well, so that is the challenge. You want to hear the challenge. That's exactly what I'm telling you. So we don't have the test, we don't have the instrument of work. If we have the instrument of work, the awareness, we have been doing the awareness on daily basis. The HIV and AIDS Day celebration, which took place with the preparation, we took like 2, 3, 4 weeks in preparing for it. Roadshow, food friendly novelty match, test kids going to the street to test, creating awareness, and I'm still wearing the cap. So that is it. So these are some of the challenges. We need support. We need to kill the stigma in us. We need to stop stigmatizing people on that. We need to defeat our minds divorce our minds from the fact that someone is positive does not mean that person is wayward. Thank you.
All right. Thank you so much, Dr. Agujobi. Now, Madam Benedict, let's come to you. While he is taking time to highlight these gaps and challenges, this is something you do all every day. You've also seen these gaps. You're not new to these challenges that he's mentioned. So talk to us about how you think this can be addressed. Because while we must achieve, if we have to, we are just at 52% as at 2023. We've not gotten the 2036 in the last 2 years. Maybe it's not 80, maybe it's 70. Until then, it still stands that we're probably not there yet. So what do you think can be done to, close these gaps, if not, eliminate it completely?
Thank you. I think one thing is to create awareness. We need to raise awareness because for a while now, awareness has been going down because of poor funding or lack of funding. Awareness has been going down, but we need to build on our awareness, on information, and ensure that almost both these cities and rural places get the information that are required to make sure that even if they are positive, to prevent the woman from giving it to their child. Another thing is that we need to scale up the services, the PMTCT services, because in Enugu State we have about 27 comprehensive sites.
This covers both rural areas.
Yes, 27 comprehensive. Then on some of the PHCs that offer PMTCT services, they are not enough. They are not enough. They are inadequate. It needs to be scaled up so that even in the most rural areas, they can be able to have access to a drug and test kits, so that without test kit, you cannot identify any positive. And when you identify it earlier, it is better. So there is need for the government or for the agency to ensure that there is always availability of a test kit, even at the rural area at every point in time, and also to scale up the PMTCT services by activating so many PHCs to provide the PMTCT services at the rural area. Then poverty is not left out. Poverty should also be addressed, especially among women. Women are mostly dependent on their male counterparts, but in this area, we need to empower our women so that they're able to say yes or say no whenever they wish to do that. And if all these things are addressed, I think it's going a long way to reduce the impact or the transmission of mother-to-child transmission of HIV. It's going to reduce it.
All right, thank you. Let me come back to you, Doc. Something crossed my mind while we're having this conversation. While she was talking about rural areas, in some local communities, you see women patronizing TBA, that's traditional birth attendants. And sometimes they don't go through these processes of you have to test, even for the proper antenatal service care, they go through these processes. I don't know if the testing thing happens or not. How much of a problem has that been? Because I know you two work with people at the rural level.
Sure.
Just talk to us about that.
When we implemented a program called Have To. Yes, we engaged these TBAs from various communities and various rural areas on the issue of awareness, seeing their best practices. What do they have to offer? A good number of them were running away from us. They thought we were going to cut off. No doubt about that, they do a lot of good things, good services. But their level of knowledge and awareness is limited. Yes. Their level of consciousness is very, very, very much limited. A good number of them who are retired matrons settled in their home and are rendering those services, you give it to them because they are trained professionals. They retire, they stay in their house, they are midwives, they are professionals. They know about referral services. They know how to refer. They know how to assess the test kits and they run the vital tests. There are some of them who do it well. This is why some of the things we discovered in the rural areas. But some of them, they have the challenge of consciousness, the level of consciousness, the level of awareness, the tools, implements of working. How much do they collect? People who patronize it based on the cost implication. That's same poverty.
That's where poverty, we should highlight.
So a good number of them who patronize it, and the services they render there is they know is they are even exposing themselves to danger of being infected. You won't believe it. When we ran tests to some of them, some of the TBS tested positive.
Positive,
And
actually.
And they never knew they were
Yes.
positive. So these are some of the challenges we have. So what we are saying is not to stop their services, but to scale it up.
Awareness.
Because they are helping to minimize child mortality.
And even train the
Yes.
TBS.
So exactly, they
Train the
need maximal
TBS so that
training
they
on
will-
the distance. So that's it. So
All right, we just need to wrap up. I wish we have more time to talk about more. But Madam Benedict, now that we are closing this conversation, for today, not the entire talk on the prevention. We started with talking about the issue of stigma when he highlighted the barriers. A lot of persons still believe that it's a death sentence. Just in 30 seconds, talk to us about someone who is watching you right now. A word of hope as to terms of should you be positive? What message do you have for them? Just 30 seconds.
Okay, thank you very much. Someone tested positive. HIV is not a death sentence. That you are positive doesn't mean that you cannot live a fulfilled life. You can still live with HIV and live a fulfilled life when you adhere to your treatment and do whatever you are asked to do as a positive person. We call it positive living. If you are living positively, that is when you adhere to every information that will support your health. You are going to live positively and get married, have your children that are negative by taking your drug very well, because they will have what to call you equals to you. When your virus load is undetectable, then you cannot transmit it. That is undetectable viral load, untransmittable.
30 seconds.
So
thank you so much. I'll cut you. Doc, before we go, just you answer this question in 30 seconds and also your parting words. Are the drugs readily accessible? Is this something I can just walk into a facility and pick up? Should I have the need to do that? And then answer that and then your final word.
yes, the drugs are accessible, especially when they get to know that the drugs are being channeled to be used adequately properly.
And it's free.
Yes. So that's what it is, So they're accessible. However, the thing there is that when the drugs are made readily available, you stick to look at when we talk about health practices of somebody looking at HIV, living with HIV and AIDS. It's not any rocket science. When you look into the health habits or the best practices of somebody who is a diabetic patient, it is more difficult to manage diabetes than HIV and AIDS. It will shock you to know this. It is more difficult because somebody who is living with HIV and AIDS does not abstain from any meal, but the diabetic patient abstain from several meals. That somebody with HIV and AIDS will eat easily. So the drugs are readily available, but once you are tested positive to it, you register, you get to be identified, you get to be assessing it. My colleagues talk about having a guide mother. That call that places call you that you have to take your drug at so and so time. Thank you.
Yeah, your parting word. I'd just like you to say something. Your last word, a word of encouragement.
Okay, I thought my time is up. Anyway, word of encouragement is we advocate for a society that is free from HIV and AIDS and devoid of any stigma. Let's not stigmatize ourselves. Live and let live.
Live
And let live. And let's tolerate.
Thank you so
whether
much.
it's HIV positive or not.
No. Thank you so much. Thank you. And that's where we draw the curtains for this week's edition of Ghana Plus. It's been quite an eye-opening session. And she talked about positive living, and he said, live and let's live. I mean, it's a simple world, and it's not the end of your life should you be positive. Thank you so much. We had Dr. Tobe Agujobi and also Mrs. Ona Benedict. And of course, my humble self, Doris Mayim Shishe. Thank you so much for listening. And of course, take care of yourself. Have a lovely evening. Bye.